Let's continue our discussion of Calley Means' book, Good Energy. Today is the second part of our interpretation. Honest people often assume that, whatever exists must be reasonable. When you see towering skyscrapers, dignified institutions, high-profile leaders, and neatly dressed staff, you tend to believe there must be powerful science and logic behind it all. Perhaps something beyond the grasp of ordinary people. Most of the time, we go with the flow and try hard just to find a place within the system. But occasionally, you might get a chance to stretch out and think about the system itself. The modern healthcare system is not a reasonable one. In fact, it could even be called absurd. Healthcare is a major challenge in every country. Here, let's focus only on the United States. Healthcare originally was a highly market-driven business. Patients sought out doctors on their own. The better a doctor's skills, the more patients they attracted and the higher fees they could charge. Drugs that were effective sold well. The patient was the core. The one who made the decisions about what was good or not, what to use or not use. It worked like other personal services, such as haircuts. Haircuts are fully market-driven, which is why they've never been a societal problem. You might think market-driven healthcare would make it hard and expensive for the poor to access care. But a century ago in Britain, healthcare was market-driven, and people never felt it was a burden. Of course, things are very different now. Modern healthcare systems in all major countries are no longer market economies. And that's not necessarily a good thing. At least three major problems arise. First, because the ones paying are not patients, but the government and insurance companies, patients don't care about cost-effectiveness. Hospitals recommend all kinds of ineffective, or even harmful, treatments to insured patients, wasting enormous amounts of money. Meanwhile, many people still can't afford care. And insurance companies profit massively in the middle. In the US, 25% of all healthcare spending ends up in the pockets of insurance companies. One recent headline was about the CEO of United Healthcare, Brian Thompson, being shot in Manhattan. The shooter, an Ivy League graduate, had no personal vendetta. He acted in the name of justice. After the news broke, 41% of Americans aged 18 to 29 said they believed the act was justified, and another 19% were neutral. Why do people hate this insurance company so much? Because it makes tens of billions in net profit each year and finds every excuse to deny patient claims. Second, doctors do not serve patients. They serve hospitals. When doctors prescribe medication or decide on treatment plans, the system requires them to consider hospital revenue. And doctors do this not to boost their own income. Their salaries are not directly tied to the treatment they deliver. In fact, things might be better if doctors' income were tied to actual treatment outcomes. This brings us to the third issue. The system does not evaluate healthcare based on treatment effectiveness. There's no website publishing hospitals or doctors' cure rates and fees, allowing you to shop around like on Amazon. You rely on vague reputations, and once you walk through the hospital doors, comparison shopping is practically impossible. More absurdly, once a patient leaves the hospital with medication, there's no mechanism for doctors to find out what happens next. Did the patient recover? Were they transferred? Did they die? Hospitals neither receive nor seek feedback. The system simply does not care about treatment outcomes. It assigns a doctor to treat a specific disease and delivers a set of procedures. It does not offer a holistic solution for your overall health. The author of Good Energy, Calley Means, had a personal experience with the healthcare system when her mother was diagnosed with late-stage pancreatic cancer in her 70s. Her condition was critical. She was in liver failure and had almost no red blood cells left. In the US, the government provides Medicare for everyone over 65, so her mother didn't have to worry about the cost. And they lived in California's Bay Area, which has some of the best medical care in the world. A top team from Stanford and the Palo Alto Medical Foundation was assigned to her. The team proposed a series of procedures: biopsies, blood transfusions, liver stents, etc. Normally, a patient would accept these expert recommendations. But Means, herself a doctor, questioned the plan. She discovered there was a 1/3 chance the treatment would be completely ineffective. Meanwhile, her mother would suffer and be isolated in a hospital room during the COVID-19 pandemic, with no family allowed to visit. There was another one-third chance it might prolong her mother's life, but only by a few months. And yet another one-third chance the procedures would actually shorten her life. Means asked directly. Even in the best case, this surgery only gives my mom a few extra months. You're still recommending it? The doctor said yes. Her mother told the doctors clearly. She wasn't afraid of death. She just wanted her final days to be more comfortable and less painful. Her entire family supported her. Yet the medical team continued to push for surgery and even shamed the family for declining. Means was very aware. The hospital stood to gain hundreds of thousands of dollars from Medicare through this surgery. Her mother ultimately chose to forego treatment and spend her last days with her family. She passed peacefully, with no regrets. No one enters medical school to get rich. They all begin with the intent to heal. But over time, many doctors begin to question whether their actions are worthwhile. In the US, once cancer is diagnosed, treatment no longer depends much on the doctor's personal skill. Everyone follows the same NCCN, National Comprehensive Cancer Network, guidelines. The drugs, procedures, equipment. It's all standardized. It's a mechanical system. That's why those experts felt comfortable recommending surgery to Means's mother. Means has a friend who's a surgical oncologist. He says, once you walk into surgical oncology, you're getting surgery. Whether you need it or not. Hospitals profit when people are sick. That's understandable. But if there's a way to reduce illness or suffering, shouldn't the healthcare system be obligated to tell patients? Means encountered many frustrating situations. For example, a patient came in with migraines. She suspected surgery wasn't necessary. Perhaps a change in diet would help. She mentioned this to a senior doctor, who replied, "As a surgeon, you must eat what you kill. Your paycheck comes from surgery." Healthcare quality and performance are not measured by whether the patient is healed, but by what treatments were performed. The system incentivizes overtreatment. The modern healthcare system is incredibly effective at treating acute illnesses, which has earned it great prestige. Now it's using that prestige to profit from chronic illness. And chronic disease means big money. In the US, 75% of deaths ultimately result from some form of chronic disease. Of the $4 trillion the country spends on healthcare each year, 80% is driven by preventable and reversible metabolic diseases like obesity, diabetes, and heart disease. Put simply, the healthcare system made its name through acute care but survives through chronic disease. So do you think this system has any incentive to reduce chronic illness? Means's mother developed pancreatic cancer largely due to chronic illnesses she had since middle age. When Means was born, she was a giant baby. A major warning sign from her mother's body. But the doctor said everything was fine. In today's America, where so many people have chronic illnesses, maybe being unwell is now considered normal. Means writes in her book, "If you have an acute illness, trust the medical system. If it's chronic, ignore it." This is a radical statement. We shouldn't accept it uncritically. I could cite many examples showing the medical community, or at least many doctors, do care about patients' overall well-being and offer advice on nutrition and lifestyle. Not all of them are just helping hospitals make money. But if you'd been through what Means has, you might also say radical things. Philip Pizzo, Dean of Stanford Medical School and an expert on pain, was appointed in 2011 to lead a government panel on how to address chronic pain in America. You'd expect someone in this role to have the public's interest at heart, right? Pizzo appointed 19 panel members, 9 of whom had direct ties to opioid manufacturers. At the same time, he helped Stanford secure a $3 million donation from Pfizer, one of the largest opioid producers. Pizzo's panel recommended opioids as the primary treatment for chronic pain. Isn't America's current opioid addiction crisis partly the responsibility of people like Pizzo? Let's imagine, just hypothetically, that you were tasked with designing a new healthcare system using public funds. Chronic illness and its complications account for 80% of all healthcare costs. Prevention costs far less. What would you do? You'd likely take action to promote healthier lifestyles, right? For example, you might pass laws requiring cake manufacturers to reduce sugar content. You might legislate a sugar limit for soft drinks. You might restrict processed foods. Some might argue that such measures violate free market principles. People have the right to eat sugar, just as the government can't ban tobacco. Maybe so. But you still have options. For instance, the U.S. government funds free lunches for underprivileged children. Since the government pays for these, it has every right to require they exclude processed food and sugary drinks. Surely that's reasonable? But in reality, none of these policies have been enacted. Pharmaceutical companies spend 3 times more on lobbying than the oil industry, making it nearly impossible for Congress to pass restrictions on opioid use. Children's food companies lobby aggressively to block regulation of advertising, which is why fast food ads for unhealthy products flood TV screens. A large portion of free lunch funding goes to Coca-Cola and Pepsi. Massive agricultural subsidies support ingredients for processed foods: corn, grains, and soybean oil. Tobacco companies receive 4 times more government subsidies than fruits and vegetables. The Academy of Nutrition and Dietetics receives 40% of its funding from the food industry. The American Diabetes Association receives millions of dollars annually from companies like Coca-Cola. So much so that they even allow their logo to appear on candy. Once you start thinking about these problems, you'll want a revolution. And that helps you understand why Calley Means started the Make America Healthy Again movement. We can't control the government. In the next episode, we'll talk about what individuals can do. That's it for today's content. Thank you for watching, and I'll see you in the next video.
If you feel there is value in this, please like, subscribe to this channel, and leave your thoughts or suggestions in the comments section. Let's grow together and read more good books.